Hi, everyone, and welcome to today's webinar, FSOMA and Legislative Advocacy. I'm Natalia Morrison, FSOMA Executive Assistant, and I'm excited to be able to host this informative webinar for you today. FSOMA, or Florida State Oriental Medical Association, is the primary advocacy association for Florida acupuncture and Oriental medicine professionals. Established in 1982, FSOMA is strongly tied to the founding of the profession of acupuncture and Oriental medicine in the state of Florida. Early board members lobbied for the statutes that govern us and went on to serve on the board of acupuncture, crafting rules that translate those laws into a full practice of medicine. In this webinar, we will discuss how FSOMA is actively involved in legislative advocacy to maintain and protect the acupuncture and Oriental medicine profession, learn how to establish a relationship with your local representative and how to become a valued resource for them. Learn about the FSOMA Legislative Committee and what their vision is for the future. Our panelists for today are Executive Director Ellen Teeter, Legislative Committee Chairperson Jennifer Broadwell, and Legislative Advocate and Lobbyist Corinne Mixon. For those of you joining us live, please write your questions and comments in the chat box. At the end of the webinar, we will go over the questions and comments. If you have a specific question for one of our panelists, please specify who your question or comment is addressed to. And let's begin. Our first panelist for today is Executive Director Ellen Teeter. She has been on the FSOMA Board of Directors since 2004 and served as Vice President for 2004 to 2006, and again from 2010 to 2012, and President from 2012 to 2016.
Yep, I've been around a while, so welcome and thank you for joining us. Natty's told you a little about us, but basically we were not FSOMA when we started. We were the Florida State Acupuncture Association, had about 30 members. We changed the name in 1994 so we wouldn't be confused with the Chinese Language Association, which is the Florida Acupuncture Association. We're a 501c6 nonprofit, and that means we have bylaws, we have an elected board of directors, we have open meetings and transparency in our governance. Where the 501c6 is slightly different than the charity 501c3, but we have plenty of laws governing how we operate. Our mission is to promote and protect the profession of acupuncture and Oriental medicine in Florida and support our members. The early members, like she said, worked to craft the laws and rules that govern us, and we've been up there in Tallahassee ever since. I've been up there numerous times lobbying and fighting for things like PIP and insurance coverage and go to AcuEd Day. So, you know, we're working for the profession. I wanted to talk a little about our governance committee structure. The executive committee is made up of president, vice president, treasurer, and secretary, and they kind of run things between board of directors meetings and handle decisions that need to be made fairly quickly. They also are responsible for coaching new members on roles and responsibilities. Advocacy, which you'll hear more about, is promoting the profession at AcuEd Day. We go to the Workers' Comp Conference. We've gone to other medical conferences, and we put out FSOMA's Find an Acupuncturist page to them as a source for referrals. The Legislative Committee promotes and protects the profession through lobbying, which you'll hear more about with Corinne, and the active promotion of the legislation. And they also were responsible for our lawsuit against the Board of PT this past year. If we hadn't been there, that would have happened. So The membership committee works to engage and support members. The annual conference brings some high quality CEUs to the state with some great national leaders and great educators. We also have a nominations elections committee that helps source board members and runs the election. Have a bylaws committee to make sure we're following the bylaws and also update them if they are needed. And an ethics committee that sits whenever we need some work on ethics, which is not very often, but we're glad to have them. So what we're doing for acupuncture is workers' comp. We go to AcuEd Day in Tallahassee. We lobby with the legislators. We sued the Board of PT for acting outside its legal boundaries and won. We bring leading educators into Florida, and we support our members with the business help desk, insurance billing help, access to discounts on malpractice insurance, office supplies, lab testing, and more. And we're always trying to improve that. So I was going to turn this over to Corinne, but she's not able to get on right now. Excuse me, just a second. I apologize. I think I'll if she can jump on, she will, but I'll just go through a little bit. I've been working with Corinne for probably 10 or 12 years now. We hired her parents as lobbyists a number of years ago, and then she has joined their firm and is now our principal lobbyist. So FSOMA's role is to be a voice for the acupuncture profession. We do state-specific advocacy, so we're working within the Florida Legislature and the Florida government. And we compete with a lot of organizations out there that are trying to get attention from the legislators. So we need all hands on deck to do this. We can't visit every legislator. The board, there's just not enough board members. So that's why we're hoping to get more of you involved, because you know, it's fun to visit your legislator. They're usually in your hometown or close to it. It's just somebody you can get to know. And you never know, they could be a referral source for you. So when I talked to Jim Boyd, we talked about the orange groves in Florida and growing up in Central Florida, which we both had done. And, you know, it was a good chat. So you're just getting to know people a little bit and becoming a resource for them. The licensure, we have a great practice act here in Florida. We have lots of, I don't know, we have a big scope of practice and we need to protect that. And just because we have it now doesn't mean it's going to be there tomorrow. So we need to watch out for encroachment, for laws and rules that might affect us. We're working to try to get ourselves inserted into legislation because we're often kind of dropped out of the medical professionals when they're making laws and rules. What Corinne does is helps to find data and collect data and helps us to surf the legislature and what's happening. They have their eye on bills that are coming up, and government, like the governor's office or insurance office, when they're going to put out new rules. So they keep an eye out for us, as well as helping us when we come up to talk to legislators. Some things we have worked on is trying to get coverage by private insurers for us. We've got ourselves in a bill about non-opioid alternatives. Right now, it's just the doctors have to mention us as an alternative. We're trying to strengthen that. And we believe that with the future scopes of practice changes that are coming, the population's aging, they don't have enough MDs in this state, that we have an opportunity to, you know, expand coverage for acupuncture. You know, FSOMA believes that that is a mandate, that people in Florida should have, you know, covered acupuncture in their health plans, that, you know, it's unfair to people not to let them use our medicine. So, so what does FSOMA do? We work to lobby. We try to meet with the big healthcare committees and the major players in healthcare. We do need your help because we can't cover every legislator out there. And you need to talk to your legislator and become a resource for them. So 2019, we kept the PTs from doing dry needling. We ensured that prescribers first recommend non-opioid alternatives, including acupuncture. We helped keep non-opioid alternatives out of the legislature from being vetoed. There were some things that we kept in active that would have not been in there. We ensured acupuncture was included in the Department of Health pamphlet, and we removed some burdensome human trafficking requirements for acupuncture using the massage modality. The massage therapists had some rules that we were able to have ourselves removed from because of the type of practice we have. So professional lobbying with Corinne, Grassroots Advocacy, political action and campaign contributions. So if you have a legislator in your area you really like and work on their campaign, that's a great way to connect with them. It's fun, you meet people. It's a way to get yourself in the community and have people start getting to know you, who you are, and what you're about with acupuncture. So we are 230,000% more likely to succeed with a lobbyist than without. It's a registered profession. They don't give gifts. They build relationships, and we have, you know, some great relationships through the mix-ins. They have a knowledge of the political process. So they might say, yeah, this bill, we may need to modify this, or we might need to find a different legislator. This guy is not going to do it, but so-and-so in Leon County might. So they know the legislators. And we're kind of repeating some things, but the legislative committee works to meet with legislators. AcuEd Day is a really fun event. We treat you to dinner, we put you up in a hotel, and we do a health fair in the Capitol building on the 3rd floor most of the time. Rotunda. So we are right there in the middle of the action. We are working on developing more hometown meetings with legislators. The annual conference is another way we're going to actually honor some legislators at this year's annual conference, and that'll be fun. We need to start some letter writing campaigns, and I've personally given public testimony in committees. And we hope to do that more as we can get more legislative action going. So I'm sorry, Corinne doesn't seem to have been able to make it. So maybe she can jump on towards the end because I'd love you all to meet her. She's really dynamic. But I'm going to turn this over now to Jennifer and let her give you some more details.
Excellent. Thank you so much. I am trying to get my screen up, so just bear with me. All right. Thank you so much, Ellen. I do appreciate that. Let's see if I can, there we go. Oh. All right. Yes, thank you so much, Ellen, for really talking to us and showing us how important it is to develop those relationships with our legislators and to really be a meaningful part of the legislative process, especially because it directly affects our ability to practice this medicine that we love and our patients' ability to have access to more healthcare options. So we wanted to have this call to give you some best practices and to kind of demystify the process of visiting with your legislators. It really is as simple as having a conversation. You want to be clear, have a focused message, be friendly, be engaging. The message for this meeting is really only going to be about developing a relationship with your representatives or if you've already met with them, to just simply deepen the relationship and keep that contact going. Because we have no pending legislation yet in this year, there's really nothing more specific to talk about. Here at FSOMA and with the advocacy and legislative committees, we will continue to hold these types of calls, and we will prepare specific talking points and have more calls or webinars when any of those bills are introduced that either affect us or directly affect our patients. So for right now, we're going to keep it very kind of conversational, and we're really just going to lay a foundation. All future contact will be much more meaningful. Anytime we come to them with an ask, it's going to be much more meaningful if they know who we are already. So it's important to start this now. So an in-district meeting is very simply just meeting with your legislator when they are at home in their local offices. And there's a lot of advantages to this. Typically, you're going to have a much calmer atmosphere. It's not quite as chaotic as Tallahassee can be at times. So you're going to have a little more time with them. You're going to have probably some less interruptions, and you'll have a little bit more time to both get to know them and let them know more about who you are. So we've created a couple of documents to try to help you with this process. You can find all of them at fasoma.org on the legislative campaign. So you could just simply click onto that link right there, and it'll take you directly into that page. And we'll continue to update that, as I said, as either new legislation is introduced or as we come up with new great ideas after hearing your feedback. So to get started, the first thing you want to do is really find out who your representatives are. So it's very simple. You can either go to the myflorida.gov and click to find my representatives. It's going to take you to these two links. So you can even more simply and directly go onto one of these. So I'm going to walk you through this just to kind of show you how simple it is. If you click onto myfloridasenate.gov, it's going to bring up a page. You're simply going to enter in your address and click to find. And once this comes up, you're going to see who your senator is. And then you're going to have this option right down here to view the complete information. And this gives such great information. From this page, you're going to be able to find out what committees that your senator is on. You can find out, it's blocked by our screen, but you can find out how long they have sat in Senate. You can find out what bills they have introduced. Media. You can also find out some about their personal interests. So you can get a little bit of a resume on them. You can also see some personal information. So like, for instance, Senator Radar has a interest in beekeeping and biking, genealogy. So if these are any of your interests, sometimes this is great information to know before you go visit, and it can spark a nice conversation with them, you know. He'd be an interesting one to talk to about beekeeping. You're also going to find over here to the left of the screen all of the contact information. So you're going to see in his local office here in Boca Raton exactly where it's located and his phone number. You're going to see his legislative assistants, which is really helpful. You'll also see all of his Tallahassee information, including phone numbers. And I'm going to show you a doc in just a moment that will be a great way to organize some of this information, because it is a lot of information to keep. So we've created something that will hopefully make this easier for you. But what you can do if you want to set up your meeting with Senator Radar is you'd simply click email this senator, or if you'd prefer a phone call, you'll just call in. When you call in, you'll simply say, I'd like to make an appointment. Oftentimes they're going to ask you, what's this in regards to? And you can simply say, you know, I'd just like to introduce myself and I'd like to get a chance to meet the senator. It is considered polite to refer to, in this case, Senator Radar as senator. And if this were a representative for one of your House representative members, it would be polite to refer to them as Representative so-and-so. So that can be a nice touch to remember. So it's very easy to find all the information you need right there. And then when you once you get that information, you can go ahead and pull up this lovely document. This is the My Lobbying Worksheet. And from here, you're going to have a spot to put in who your state senator is. both the local office phone number as well as the Capitol, state reps right here, what committees they're on. Once we get further into the legislative season, you'll be able to, and if any bills are introduced, we'll have a spot here where you could put in the bill number, the bill title, and then we'll provide additional talking points for those. So hopefully this will just be a nice, concise way for you to keep all your information in one spot. And so to visit your legislator. Visiting the legislator is really kind of basic conversation 101, you know. We want to arrive on time. You want to be dressed professionally. You always want to be polite, friendly, engaging. This really is a conversation. You know, they're meeting with so many people on a day in, day out basis, and a lot of those people have really specific asks for them. At this point, again, we do not have a specific ask. So use this as an opportunity to get to know them and really just build that relationship. You will get a chance to possibly meet with their staffers, and occasionally, if they're not available, you will have your meeting with a staffer. Or sometimes your meeting will get changed and it will be with the staff member instead of the legislator themselves. And that is not a problem at all. That's actually just as good. The staffers are really knowledgeable about the details of all the legislation. They're oftentimes the one that are giving that information to the representatives. So they're a great person, a great point person to get to know. So it's certainly always a good thing to meet with anyone within the office, even if it's not the representative themselves. And when we're going in to meet with them, what we want to do is have a bit of a message. You know, what are we going to say outside of that polite conversation? So you do want to introduce yourself and let them know who you are. If you're a constituent in their area, that's important and you want that to be known. And then tell them a bit about yourself. So for instance, for me, when I've gone out, I'll start with, you know, hello, my name is Jennifer Broadwell. I'm a licensed acupuncturist and a small business owner in Palm Beach County, and I'm passionate about healthcare. And as we saw from my senator's information, he's part of a healthcare committee. He's also on a committee for children, families, and the elderly. So I could also say something like, you know, I have a strong pediatric practice as well. Something that ties back to his personal interests, might spark a little more communication. And if you have a patient referral, you're welcome to bring that in. That might be a nice touch, something you could leave them with. Let them know the power of acupuncture. You could certainly ask them, have they ever had acupuncture? What was their experience like? Want to make it conversational. This is not something that you really can market your practice with, although oftentimes these relationships can develop into that, but you certainly don't want to use this as an opportunity to market your practice. The focus of the meeting is really to get to know them and to build that relationship. And we would love it if you would take a photograph. We have quite a few on our website, and we love to post them. I think it really helps to encourage more people to go and to demystify it. And then, of course, you'd thank them for their time. So a couple little basics. We've talked about quite a few of these. But another thing that we're going to provide for you is a handout that can give you some guide talking points for this. And that's something you can also leave with them. For your meetings, you can plan for maybe 15 to 20 minutes. It's great if it'll go over, but plan for about that depending on how busy their day is. And you always want to bring a business card so that they have your contact information. And bring some pen and paper in case there's any questions that come up. Anytime there's a question that you don't know, make certain that you write it down and that you're really clear that that's not something you know, but that you'll find the answer. And then you have another opportunity to follow up. And here are those talking points. Again, this is all available on the website under the legislative page. And so this is a great document that shows and answers who we are and also kind of what we do to a degree. So it's important that they know that FSOMA is our state organization, that we have that level of representation and organization as a profession. And so this will tell them a little bit about who FSOMA is. It tells a bit about our educational requirements, how we are nationally nationally tested and have 4 examinations, details how many hours of education and clinical practice we have, and it also gives a few quotes from the World Health Organization as well as the National Institute of Health. So it's some nice talking points to let them know who we are. So we've talked a lot about what we could do or what we'd like to do. We've got to mention a few things we really don't want to do. We never get that second chance to make that first impression. And so it's really important that we never lie or simply answer a question that we don't know. If we're unsure about it, it's such a great opportunity to say, hey, I really don't know the answer to that right now. Let me find out and I'll get back in touch with you. And again, with the pen and paper, you can write that down and then follow back up. You do not want to offer goods and services, so this is not an opportunity to offer a free treatment for either the representative or their staff members. We do not want to speak negatively of any other professions. As we said, right now there is no current legislation that's affecting us. We want to keep a very friendly tone in all of our communications. You know, we all respond better with that. And we don't want to pick out any one profession or multiple professions and speak negatively of them. It certainly can be interpreted as an antitrust issue, and that is becoming more and more of an issue in our world. And at the end of the day, when we leave, what we would hope is that we have a really nice, friendly rapport, and that they see us as professionals and want to use us as their resource when healthcare policy comes up. So the more professional we are in our tone and tenor with that, the more likely we are to build that relationship. So after your meeting, how will you follow up? Well, you should send a thank you. Excuse me. We do want you to send a thank you. You can do that via email or with a letter, hopefully within the 7 days. If you had any kind of a personal conversation or any kind of personal detail that you can mention, that's always nice to personalize something. It makes everyone feel more special. Again, you want to offer yourself to be a resource for any questions they might have on healthcare policy. You also want to provide FSOMA contact information and let them know that we are also a resource. If you took that photo that we hope you did, then go ahead and send that over to Ellen. And then share your story. Let your colleagues know. Hopefully it was easier than you thought it would be. If you want to offer to go with anyone else to a meeting, please do. If any of you are intimidated to go to a meeting, let us know. And FSOMA can certainly try to find someone in your area that can accompany you with that, make it a little bit more comfortable. And hopefully you still want to get even more involved with legislative efforts and advocacy efforts. And in that case, please join us for FSOMA's AcuEd Day. We will be holding it this year on February 4th. And that actually says 2019, but it will be 2020. So I think I said that in incorrectly. I apologize. And then you can also join the FSOMA Legislative Committee. All of our committees are open to any FSOMA members. You do not need to be a board member. We would love to have new ideas and new people, and it's a great way to really develop relationships and develop ourselves professionally. So I would invite and welcome any of you who are interested to please contact us. We'd love to have you on our committees. And then continue to check out the FSOMA website. We will be updating it with any new handouts that we can come up with and any new policy changes that come up or any proposed. So thank you so much. And if you have any questions, please reach out.
Thank you, Jennifer. I'm going to take the opportunity to say hi to Corinne. Thank you for coming in. And I'm so sorry about the time mix-up. We did run through your slides, but I'm sure there's more you can tell us. Corinne's been our lobbyist for, well, your family's been our lobbyist for 12 or more years, haven't they? 10 or 12 years?
That's correct.
Yeah, and we're very happy. You're with Rutledge and Ascena now, but she's great. So I'm glad you were able to join us. So.
Absolutely. And can you hear me okay, Ellen and the team?
Yeah.
Yes.
Okay, wonderful. Well, I will just take an opportunity to go back through. I apologize, the mix-up was on my end, so thanks for bearing with me. but I plan to share my screen so I can run back through a couple things and maybe hit a highlight or two.
Yeah, I kind of used your slides, but I didn't say what you would have said. So
not a problem. So let's see if I'm able to share my screen here with you all. And share. I think this will be the one here. Are you able to see that yet, everybody? Not yet.
We can see it. It's not, you need to play the slide maybe.
Yes, I will do that. And here we go. Let's see. All right. So again, I'm Corinne Mixon. Thanks for your patience with me. I am one of the lobbyists for FSOMA. I presume everything's working well audibly and digitally in general now. Super proud to do this job. I've done it for about 13 years. I've been involved with FSOMA for a number of those, probably 8 or 9 at this point. And it's a real pleasure to do the work. So as you probably have already heard, as an organization who focuses on state-specific policy, we do a lot of state advocacy. So we're the voice of the acupuncture profession in that way. We have a major role as FSOMA or any other organization to make sure that we're heard by the legislature. This can often be difficult in a legislature that is also listening to groups that are in some cases smaller than our organization, but in some cases much, much larger. And so if you look at, for instance, the Florida Realtors Association, they have upwards of 50,000 members. If you look to the biggest healthcare association, the Florida Medical Association, they're looking at about 25,000 or so members. So just to be a voice and compete with that kind of energy in a space where you only have 140 legislators, it takes a lot of work, and it's commendable that this organization has been able to get such a foothold in this. So I wanted to just, and again, if some of this has already been gone through, I just want to try to underscore some of the importance, but you know, we have states that really have fallen back on, for instance, licensure. One of the things this organization has done since its inception was to make sure that there was a great practice act for acupuncturists here in the state. States that don't have that ability, that don't even have a licensure act and statute, they cannot, for instance, grant or retract somebody's ability to practice. They can't discipline their bad actors, establish the minimum standards that protect the people that you serve in your craft. And also it gives us a digital database of practitioners so that the legislature, when they need data, when they need information on who's taking care of whom in the state, we know your name and what kind of practice you're in and that sort of thing. That helps us pass smart state policies going forward. So again, there are states that don't have this. There are states that don't even have a practice act for acupuncturists. That's not something we can even believe at this point, but that's to underscore the importance of state policy. But there are other sides to state policy. For instance, who is going to get covered by insurance, whether it be public or private, meaning what kind of providers, what kind of services they provide, of course. Looking at where the crossroads are between opioid drugs and non-opioid alternatives. And then something that's also been of interest in recent years is scopes of practice. In a population that is aging rapidly, who should be providing what kind of care? The legislature is curious if it's standing in the way of that care being delivered. Should other people be able to provide more care even though it wasn't their traditional scope of practice? That sort of thing. So again, FSOMA and organizations like FSOMA that really focus heavily on state advocacy, these are some of the impacts that can have. To kind of whittle that down, it means that really, if this organization and our neighboring organizations in the continuum of care are not advocating for smart acupuncture policy, nobody is. There's simply nobody else out there that's thinking about this stuff all day long. And so none of it's possible without FSOMA and organizations that align with us in our quest for good advocacy. So a few things that we achieved, and I'll be brief about these as you may have discussed them generally, but of course on the legislative and legal front, FSOMA was able to stop efforts to increase the scope of practice, which I mentioned a minute ago, for physical therapists who want to do dry needling in sort of a carte blanche manner. That is something we have to be a watchdog for legislatively, of course, but also something that this organization was heavily involved in on the legal front last year. These are all very recent, by the way, efforts that this organization took on. The other is to ensure that prescribers, meaning doctors and nurses and PAs and others that are prescribing medications, including controlled substances, that they're looking at non-opioid alternatives first, that they're recommending non-opioid alternatives first. Not only does this really improve the continuum of care with you and your co-providers that are also licensed under DOH, such as the groups I mentioned earlier, but it really makes sure that the patients of those very busy practices are told about these alternative treatments. Without FSOMA's work to help get this amendment into the bill that passed last year, we would not be in a position where now every provider, before they prescribe an opioid, needs to say, have you considered this opioid alternative, such as acupuncture? Piggybacking on that, that bill was nearly vetoed last session, or at least it was in the late hours asked to be vetoed by a couple of groups who weren't necessarily involved early on in the development of that bill. FSOMA and its neighboring organizations were extremely helpful in making sure that that bill was signed into law and was not in fact vetoed. And on the very back end of that same policy, again, just this summer, the organizations representing acupuncture were able to ensure that acupuncture was included in a pamphlet that is given to all patients before they take an opioid that says, here are some alternative treatments. That pamphlet now expressly mentions acupuncture, which was something we were very glad to see. One more accomplishment, and again, all of this in 2019, was that many years ago, we were having especially inordinate numbers of issues with human trafficking developing through a network of massage establishments that were not licensed. The state came in and made a bunch of rigorous changes to ensure that these human trafficking cases were really clamped down on. That legislation has been very successful. However, because a lot of acupuncturists provide massage in their establishments, acupuncture and some other groups were sort of swept under that umbrella and had some unnecessary burdens for an acupuncture practice that might be necessary for simply a massage practice that just is operating under massage establishment permits. So this year, we were able to get an amendment in the final days of the legislative session that ensured that some of those over-cumbersome requirements don't apply to acupuncturists who are doing massage in their practices. So how does FSOMA impact these statewide outcomes? Well, there are really three ways that I can think of. One is professional lobbying. The other is the grassroots advocacy that Jennifer so eloquently spoke about a moment ago. And then also political activity and campaign contributions. Professional lobbyists, that's my role. We are a registered organization. Essentially, because you guys as members of FSOMA and acupuncturists in general, you might do your own lobbying, of course, and we've talked a lot about that. That's what Jennifer was discussing. But there's another type of lobbying. It's the professional type. And if you're paid to do that job and it's the primary role of yours to do that job, then that makes you a person that needs to be registered as a lobbyist. Studies such as one in NPR done in 2016 essentially relayed that if you are an organization like FSOMA who hires a lobbyist, you're about 230,000 times more likely to pass a bill or an appropriation. The reason is your lobbyists hopefully can build relationships, coalitions of people, such as legislators that'll be attending our upcoming conference. We're knowledgeable about the general scopes of legislation, what's realistic to pass, what's completely unrealistic to pass. A lot of organizations have great ideas. In some cases, they're extremely lofty. A lobbyist should be able to tell you, this is a wonderful idea. It's not going to pass, so please don't waste your energy on this. So that's sort of the professional lobbying side. Then again, you have your grassroots advocacy, which you've already heard so much good information about, your hometown meetings, political activity, your public testimony during committee hearings, These are all your grassroots activities, including those hometown meetings that Jennifer discussed a few minutes ago, AcuEd Day, and others. The last slide somehow didn't make it on here, but that's relating to political activity. A big part of what we do as an organization, whether it's giving to campaigns through our members, contributing, or whether it's going out and walking in campaigns, all of the folks that we're walking for, in theory and hopefully, will be legislators one day. So all of the time that this organization invests in getting folks to be active in campaigns and give political contributions, it's time well taken, because ultimately those candidates, they become the legislators. And FSOMA has been very successful by working on those efforts. It's something that always needs to grow, but it's something that I know the organization is very committed to. So with that, unless the folks that are also taking part in the panel or otherwise have questions, I think that's sort of my presentation. Hopefully it didn't take too long with the stuff y'all had already gone over. So,
thank you, Corinne. All right, Natty, have you been monitoring the chats?
Yes, thank you everyone for joining us. We are live on Facebook as well as through Zoom right now. So for those of you that are watching us, if you have any comments or questions that you want to ask, whether it's a general question or if you have a question specific to our panelists, please go ahead and take this moment and type it into the chat box. We have a couple of you that are joining us live through Zoom, and we have a few of you that are also joining us live on Facebook. Okay. So I'm super excited to be a part of FSOMA in this new role as executive assistant, and being able to help present these webinars for you. And like both Ellen and Jennifer mentioned, we are definitely planning on being able to bring more of these educational and formative webinars for you, members and non-members of FSOMA. As you see, Jen and Ellen are very passionate about their role in FSOMA and with our profession. And I'm super excited to, like I said, be involved. And so we'll be orchestrating and organizing some really fun webinars for you. And if you have something specific, a topic that you are interested in, please share that with us, and we will do the best we can to make it happen. Okay. So far we don't have any comments or questions.
Natty, can I make an ask?
Of course.
Thank you so much. I'd just like to ask of anyone who is listening to this, if there is anything that we can do, is there something that we can provide to you or some other way we can help to make it easier for you to get out and meet your legislators? So if there is something that you can think of, please let us know and we'll create around that.
I never showed the FSOMA homepage and how to get to the legislative page. Why don't I do that real quick?
Great.
So this is the FSOMA homepage, and right now you've got to scroll down all the conference speakers' videos, and you keep going, and on the left here, if you keep going, oh, where did it go? Legislative campaigns under the Tallahassee sign. You click on that and it'll take you to a page that has links to the kit, to how to speak to your legislators with a lot of the detail that Jennifer presented. It has the worksheet for you to download. And you certainly don't have to fill out everything on here at first, but you know, concentrating on your senator and representative would be good. It has, this link is to find your legislators. And then we've got some handouts. I don't oops, I will put them up tonight. The first handout of Take This With You. But we have some other handouts if you want to talk to them about how good we are with pain that you can take. You don't have to send all of these. If one is good to talk to, put them up tonight. The first handout of Take This With You. Okay, so I will add one more handout, which is the talking points about our training and that information. And I'll get that up there tonight. So, all right. I think.
Okay. Well, thank you, everyone. I think we don't have any questions from any of our viewers live. Thank you, everyone, for joining us. We are thrilled and excited we were able to present this for you all tonight. And feel free to reach out to any of us directly. Just go to fasoma.org and you will be able to connect with us. We're also on Facebook, Instagram, LinkedIn, and Twitter. Feel free to follow us and have any comments or questions. Go ahead and do so. All right, well, this is the end of our webinar for today. Thank you to our panelists for joining us, and thank you everyone for watching.
Thank you all.
Thank you, ladies.
Bye, have a good night, everyone.